A lot of the different symptoms that they may experience are common ones that happen in everyday life, which can then make it sometimes more difficult to determine, is this related to things that are happening to my gut, not related to the hormonal changes of the menopause journey, or are they related? So, some typical symptoms would be gas, bloating, constipation. You may see a change in bowel habits. I had mentioned that there's an increased risk of gallstones. A small percentage of people may experience some nausea. Small percentage of people may have some abdominal or pelvic pain, and people who have never had a problem with heartburn, or at least heartburn that they have felt, called reflux, may begin to experience. And I had mentioned the impact on hormones related to your appetite, and the drop in estrogen can change the levels of those hormones. So you may typically people will see an increase in their appetite, or they will start having a food craving similar to what some people may experience during pregnancy. And in terms of how do you tell the difference between the two, it really involves looking at the whole person. As is so often the case during menopause, a lot of the symptoms, other than kind of the stereotypical ones of hot flashes and night sweats, are often symptoms that many people have on and off during the course of their lives, including men. Typically, in terms of testing for hormone levels during the period of time that a person may be making the transition, the recommendation is not to do the testing because of the definition of what menopause is, which is 12 consecutive months without having a period. Now, that gets a little bit more complicated, obviously, if you have had a hysterectomy, for example.